Hello, my name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. Once again, thank you so much for being readers, subscribers, members of SCCM. You really do support the journal. It's going to be a bit of a rush this month just to get all my messages out to you. The format for my editor's choice is slightly different in that I'm only highlighting two research articles. The first is about the question, does implementation of an antibiotic guideline for ventilator-associated infection make a difference? Carcese et al. In the VEIN-2 study have looked at 2 years worth of data, 22 PICUs in North America, hundreds of patients. You absolutely have to read it and the editorial to go with it. The other clinical research article really addresses the question about engineering descriptors in pediatric patients with acute respiratory distress syndrome. What do we really need to know? Diaz et al. Have looked at mechanical power in a post-hoc physiological study in which they have both PARDS patients as well as pediatric anesthesia patients. Again, must read as well as the editorial. So now I can take a bit of a breather, and what I'd like to tell you about is a completely new format for PCCM, and this is called Case Conference Records. If you're a reader of the NEJM and you know about the case records at the MGH, something similar. But here we're focusing on cases in pediatric critical care, and we really want to reproduce the case conference that all of us love to attend. So our first one of these comes from Colorado, and Lois et al., along with experts, talk about a 10-year-old male with respiratory failure after stem cell transplant. How do we explore the differential diagnosis? These are not case reports. They're educational material that helps readers explore how they should be practicing. Please read the section that I've got in my editor's choice that's in the print issue of the journal so that you can understand the criteria for submission and publication. I want to stress that I need support from all of the centres, all of your centres that are out there. And lastly, there's a special section for SCCM members called PCCM Connections for readers. 2 articles in the October issue, one by Hoffman et al. On point-of-care ultrasound and the quadriceps femoris. That's the 9th in this series of articles this year. And the other article is by Jiva et al. About the integrating a checklist with the electronic health record, decision support. This is the 5th article on workarounds in PCCM. So take a breath, manage to get through everything. See you next month. Really thank you for being involved with the journal and reading it. See you in November.